take yourself off camera if you'd like to. Like I said, I'm Ashley Harrill. I work for talent acquisition. We also have Brian Lake with our 9 Trauma Medical Surgical. We have Richard that is coming from our solid organ transplant. And then we have Melanie here, and she's from Bellevue Medical Surgical. So if you guys want to go ahead and start by just sharing a little bit about your patient population and about your units. Brian, do you want to go ahead and start?
Oh, sure. Hi, Kelsey. I'm Brian Lake. I'm the nurse manager for 9 Trauma. It's an acute med-surg adult unit on the 9th floor of Clarkson Hospital. We're a 38-bed unit. We handle both med-surg and telemetry type patients. The bulk of our patients are trauma related and also emergency general surgery. Trauma sounds kind of sexy, but the bulk of traumas are typically like a ground level fall, things like that. But we do see motor vehicle accidents, assault victims, self-harm. What kind of stands us out as far as patient-wise, which is a little bit different, to best sum it up is our patients are more hurt as opposed to sick. And so what you see as patients, you're going to see a lot of like physical damage or physically broken individuals. It is rewarding in that when you care for them, you actually see that healing process and you see them improve on the unit. Most of our patients, obviously, we try to send them home or we're sending them to rehab or a skilled nursing type facility. But yeah, I mean, for the most part, most of the units are pretty similar as far as patient care wise and the ratios. Ideally, we try to operate with 4 nurses or 4 patients on days, 5 on nights. But with our current situation with COVID and everything, those numbers have caused us to stretch a little bit. We have been partnering, we've been kind of innovative in this piece here. We've been partnering with some paramedics. So we brought some paramedics onto the unit too to partner with the nurse to able to kind of focus and handle a little bit larger assignment. And that seems to be working very well. We're a very team-oriented unit. We do welcome new grads specifically. And yeah, it's a very hands-on unit. We have a lot of device-related drains, immobilizers, splints, all those things that kind of look scary when you first look at the patient. But rest assured, we'll get you comfortable taking care of those types of patients. So that's all I have. Yeah.
Thank you, Brian. Richard, would you like to share about your department?
Definitely. My name is Rich. I'm the supervisor on SO2, or the solid organ transplant unit. Our patient population is mostly patients that have liver, kidney, small bowel transplants. We work with patients that either have had a transplant, are listed for a transplant, or do not qualify for a transplant. So basically, if they have any issues with their liver, kidney, or small bowel, they're going to end up on our floor. But one of the most rewarding things on working on this floor is that you can actually see patients receive transplants, have a second chance at life, and really recover and just thrive with the new organ. It's definitely the most rewarding thing about working with these patients. But they are definitely a difficult patient population because these patients are really sick. When these organs don't work, it affects their entire body, and it really shows. Especially with our liver patients, they can become encephalopathic or confused and definitely harder to work with. But seeing them on the other side of that transplant, when they improve and their mentation comes back, it's just one of the most rewarding things that's why I go into nursing, just to see something like that. Our unit is a 36-bed unit. We have ratios similar to 9 Trauma. We try and do 4 during the day and 5 at night. Something that sets us apart is we are partly a progressive care unit. We have specialty training for our nurses so that they can take care of fresh kidney and pancreas transplants right out of surgery. Those patients are 2-to-1 for kidneys and 1-to-1 staffing for pancreas transplants. Because for the pancreas, we're doing blood sugars every 15 to 30 minutes. So we're definitely in there quite often. But yeah, that's mostly it.
Thank you so much, Rich.
No problem.
Welcome to Meg. She's also from Bellevue Medical Surgical. And Marla, she comes from 4 and 5 lead, or our ortho and acute care medical surgical. Meg and Melanie, would you guys like to share about Bellevue's medical surgical unit?
Sure. Hi, Kelsey. I'm Melanie. I'm one of the managers. Meg is my partner in crime, and you're probably wondering, why do they have 2 managers for 1 unit? We actually have a really big unit. So even though it's still considered 1 unit, it's 2 separate floors. So it's on 3rd and 4th floor at the Bellevue Hospital. There's a total of 72 rooms. 36 on each floor, and we're only going to a max census of anywhere between 52 to 58 patients right now. Our nurses, we try to keep them just like the other units that you heard from. We try to keep them at 4, but they've been going to 5 on days, and then 5 and 6 on nights. That's kind of our normal ratios. We see all different types of patients at Bellevue Med Surg. So all of our nurses are stroke certified, because we are a stroke and chest pain certified hospital. So that's one of the unique things about our unit, is that you'll get that NIH stroke certification during your orientation. We have cardiac patients. A lot of our patients are on telemetry, and we do some cardiac drips on the floor. We also have a heavy focus on ortho patients. So you'll see total hips, total knees, shoulder surgeries. And then we also have your general med surg patients. So lots of different patient types. We are an adult only floor, so our patients are 16 and older. It's really nice being at Bellevue, because you have the support of the large academic medical center, but it's just kind of on a smaller scale. So I always get lost whenever I go to main campus, even though I've been here for 5 years. I'm still always on the phone trying to figure out, I'm in this hallway, where do I go next? And so I've never been able to really figure out my way around there yet. So if you're more interested in like a smaller feel hospital where you get to know lots of different people, then Bellevue is probably the right fit for you. So Meg, is there anything you want to add?
No, Melanie, you did a really great job. Kelsey, I'm Meg, and I am blessed to know that others, I don't know Rich as well, but I'm blessed to know the other managers on this in this room as well. And any choice that you make at Nebraska Medicine is a great choice. I spent most of my time at on main campus as well, but there is a little something special about Bellevue. I think it's a really great place, as Melanie said. I think the variety of patients that you see is really something that is impactful for any nurse, but particularly new graduate nurses as well. So no, Melanie did a great job explaining the unit. We partnered to really manage the whole inpatient areas. The core of that is the 3rd and 4th floor. We also have a small 8-bed ICU on the 1st floor as well. So it's a great place to be. I moved there about not quite 4 years ago, and I really just love the environment there. Main campus is amazing too, but just like Melanie said, if you like a little smaller community feel, definitely Bellevue is a wonderful place to be.
Thank you, Melanie and Meg. And then Marla, would you like to share about your department?
Yes, hi, I'm Marla Melgoza, the manager of MedSurg Ortho Floor. My unit is located on main campus. We are a 40-bed unit. We're separated 20 beds on each floor. So 4th floor and 5th floor is considered 1 unit. I would say probably about 30% of our patients right now are ortho patients. So a lot of them are people that come in and get planned hip replacements, knees, shoulders. We do some spine surgeries as well. They're very well educated, prepared when they come in, know exactly what's going to happen. Usually are only here like a day or 2, and then they get discharged home. The other 70% to 80% of our population is your typical like med surg tele unit. So we have a wide variety of patient conditions, lots of like kidney, pneumonia, GI bleeds, etc., infections, cellulitis. They come from the ER. We get transfers from the ICU once they're stabilized enough to come out to the floor. We get direct admits from surrounding communities as well. But yeah, just a fast-paced floor. It's med-surg, so probably about 10 to 12 patients get discharged out of the 40 every day, and we always fill up with new patients. So you'll definitely be seeing a wide variety of different patients and conditions. So as a newer nurse, it is great experience and a great place to learn from your fellow coworkers too. I have a wide range of staff tenured. So I have experienced nurses, I have new grads, I have people kind of right in the middle. So lots of people to learn from and soak in all that nursing knowledge. So.
Thank you, Marla. We have about 5 minutes left of our breakout session. So if you have any questions, Kelsey, please feel free to jump in. Otherwise, maybe we could each share something that is maybe unique about your unit, or what the culture is like on your unit, what would make this an ideal place for a new graduate or an experienced nurse. I don't know, Kelsey, if you're new or if you have some years under your belt.
I'll be a new grad, yeah.
Great.
Yeah.
So maybe what would make your unit an ideal place for a new graduate nurse? Feel free to, yep. You want to start, Rich?
Yeah.
Great.
So we have a lot of students currently working on our floor, and we see lots of students every semester. We have a lot of seasoned preceptors that have been working with our patients for quite a while. And honestly, our culture of teamwork is phenomenal in our unit. I can say that probably every unit in Nebraska medicine is going to have great teamwork, because if the pandemic has showed us anything, it's how resilient we are as nurses and how well we can work together when we need to. So honestly, any unit you choose is going to be a great option, because I mean, I believe in our hospital and our enterprise of Nebraska medicine. But specific to our floor, we do have a lot of seasoned nurses that are precepting and training new hires and training students. We have a lot of different experiences that you can have on our unit as well. We have lots of drains, wounds, that kind of comes along with the patient population.
I agree with what Rich was saying to Kelsey, really just Nebraska medicine in general, and the I teach values that every unit really tries to ingrain is really, something to consider when you're applying for your jobs. I think the culture of most units is wonderful. I don't obviously know them all, but I think that that's something special about Bellevue too. We don't have quite the amount of resources, so we all really all hands on deck whenever needed, and we love that. And I think the variety of patients that you can see and experience is probably something unique to Bellevue, since we're kind of not really service line oriented. So, but again, any choice you make would be good.
Thanks, Meg.
Yeah, I don't know what else to repeat on. I mean, I'm just repeating on everybody else, but I would just say, Kelsey, I mean, we see with 9 Trauma, not only do we work great teamwork with nursing in particular, but we also work very well with the other disciplines, as physical therapy, occupational therapy, respiratory, speech, social work, care transition nurses. I mean, there's just a whole different gambit. It's not just within nursing itself. So you're going to be very supported here in this organization, just house-wide.
Great. Marla, did you share that your unit has some sort of like mentor program, or was that you, Melanie and Meg? Yes, you guys have like a mentor program for your new nurses to help support them.
The mentorship program, every new nurse that comes to our unit, even our nursing assistants, are paired up with a more experienced nurse or nursing assistant. It's really just to kind of make a connection with that person. You can reach out to that person as much or as little as you need, by just reaching out to them during your shift, or even setting up like outside things to do. You can take that as far as you would want, but it's just your identified go-to person that is there to answer any questions, be your resource, be your support. We've had that mentorship program in place for almost 2 years now, and it's been really successful.
Thank you. As a new graduate nurse, you are welcome to start going through the application and interview process within 6 months. So if you have any questions about how that would work, please feel free to, let us know. I know that, all the managers are always super excited to hear of some, new graduate nurses that are excited to get into, get ready to get started. We have really good resources to support our new nurses. You'll hear about later, like our nurse residency program. We've also started a new colleague experience. So you're going to be getting so much information when you first start, not only just about the organization, but on your units. So we've set up a roadmap so you can attend different sessions throughout that first year to learn more information about benefits, growth and development, our total rewards programs, diversity and inclusion, just all meeting with our leadership teams. So we've really tried to make it a really smooth transition from nursing school into your nursing career to make you successful and make you flourish on whatever department that you decide that you may want to work on. Do you have any questions for us, Kelsey? I don't want to put you on the spot. If you don't, that's completely fine.
You're fine. I just want to say thank you guys for all the information. I don't have any questions right now, but just kind of taking everything in. So
Wonderful.
sounds like a great place to work. So I'm excited.
Great. Where are you going
Thanks,
to be
Kelsey.
graduating from?
College of St. Mary.
Wonderful.
Awesome.
Yeah.
Do you guys graduate in December?
In May.
May. Okay. So you're getting right up there. Are you
Yes,
excited
ma'am.
for your last semester?
I am very excited. I'm very excited, yes.
I'm sure.
It'll
You're
fly
getting,
by.
it will. You're getting to the fun part now.
I
Getting
am, yes.
all the clinicals and getting to kind of see what is out there. So
Yes.
that's really exciting.
Yes. So thank you, everyone.
Thanks for
Yes,
joining
thank
us,
you.
Kelsey.
Thanks for
You're
joining us,
welcome.
Kelsey.
Good luck.
Yes. Yes, good luck.
Thank you.
Welcome back. I think everybody's coming back from their breakout sessions. Okay, we'll give it just a couple more minutes and then we're gonna let Brandy Johansson and Sarah Swistak speak about their department and what they have to offer from 5 West. Everybody should be back from their sessions. So if Brandy and Sarah would like to get started, we would love to hear from you.
Awesome. Ashley, can you hear me?
I can, thank you.
Perfect. Hi, everybody. So first off, as Heidi said, thank you so much, everybody, for joining us today. We're so excited to talk about Nebraska medicine and all the amazing things we have to offer. So I'm going to specifically talk about 5 West, our unit. I'm going to first open up and kind of talk about just a small glimmer in my journey. And then I'm going to have Sarah talk about what her journey has been too, up into taking on the NPDS role. So as I said, I'm Brandy Johansson. I'm the nursing manager for 5 West. So I started at Nebraska Medicine as a brand new graduate nurse as well, just like Heidi. I also started in 2006. So I also have 15 years of experience at Nebraska Medicine. Started as a brand new grad. Like I said, I worked nights for 6 years. I was a lead nurse on nights for about 3 years. And then I was the associate nurse manager on 5 West as well for about 3 years. And now I've been manager of 5 West for a little over 4 years. I am a med-surg nurse at heart. I can imagine myself doing nothing else than med-surg nursing. I have a strong passion for med-surg nursing. Love what I do. I love the med-surg life. I love getting to know patients and all those things. I also have my master's in nursing education. I got that in 2018. I love new nurses. I love to teach. Sorry, my cat keeps jumping up here. So that's kind of my little bit of journey. So I'm going to let Sarah tell hers.
All right, can everybody hear me? Hello?
Yep, Sarah,
Yes,
I can
we can hear you.
There we go. All right, hi everybody. My name is Sarah Swistak. I am the Nursing Professional Development Specialist for 5 West. My journey started on 5 West as well. back in 2011, I believe. I was a CNA on 5 West for 4 years while I was going through nursing school at UNMC. I then took a staff nurse role on 5 West. I was a nurse out on the unit for 6 years. I did various things in that staff nurse role, including the relief TL, UBC chair, and sat on many of the hospitals' shared governance councils. I also love med-surg. I feel like there's just so much to learn at that med-surg stage, and I love our ability to be able to take the time to get to know our patients and their families and really get them set up for success to go home. Because I love teaching, I always was the first one to sign up for students, new nurses. So when the opportunity presented itself this spring for me to step into the professional development role, I jumped on that opportunity. So I've been in this role about 6 months and I am loving it. I love being able to teach new nurses that come into the organization, as well as continue to work with the staff on 5 West to help them grow and develop in their careers and their journeys.
All right, Ashley, can you go on to the next slide? Thank you. So I'm just going to briefly touch on our leadership team on 5 West. So our director, her name is Angie Best. She's amazing. We all have a great relationship with her. She rounds on the unit a ton. She checks on us. She's just an amazing person. So obviously I'm Brandy, I'm the nursing manager. And then we also have 3 nurse supervisors. So Diane, Emily, and Michelle. We have 1 day shift supervisor and 2 night shift supervisors. Their role really is kind of just an extension of me. They are leaders on the unit. They are there when I'm not there to answer questions, provide support, all those things. And all 3 of them are just awesome. We also have 1 staff nurse lead. Her name is Taylor. And then obviously Sarah are in PDS. We also have a 5 West administrative senior assistant. Her name is Laura. She's kind of the person you really want to get to know because she helps get you paid every day. So she is just a really, once again, an extension of me and Sarah, kind of our right-hand woman. We also have a medical director. We have a really great relationship with our medical director. His name's Dr. Bunham. He's, once again, kind of like Angie. He checks on us all the time. He buys food for the unit. He is just an amazing doctor and a great support for our staff. Go on to the next one. So just want to kind of give you a 5 West unit overview. So our unit has kind of went through a very unique journey over the past 2 years with COVID. So I'm going to first talk about what 5 West normally is, and then I'm going to talk about what 5 West currently is. So 5 West, as I talked about, we're kind of just that everything unit. So we take all adult medical surgical patients. We have 33 to 38 beds. We do have semi-private rooms, so that's why I say 33 to 38 beds. And we have telemetry capability for every bed. Something very unique about 5 West as well, we have a centralized nurses station. We are very much a teamwork oriented unit, and I think that has a lot to do with our centralized nurses station. Our team, as Heidi talked about her team, we laugh, we get to know each other on a personal level, talk about what they did over the weekend. And that's just a really fun part of our unit as a centralized nurses station. So talking about kind of patients that we take care of. So a lot of CHF, respiratory issues, COPD, asthma exacerbations, pneumonias, sepsis. Sepsis is actually our #1 DRG that we take care of on 5 West. We see a lot of bowel obstructions, liver and kidney failure, diabetes. About 75% of our patients on any given day are diabetic. So we take care of a lot of diabetic patients. Psychiatric illnesses, so bipolar, schizophrenia. We do see some suicide attempts of patients. So a little bit more of those psychiatric illnesses. 5 West does take care of 2 specific populations that only come to our unit. One is the bariatric surgery population. So these are patients that come in for a gastric bypass or a gastric sleeve. And then we also take care of cystic fibrosis patients. So I'm sure you guys can read there, though. These patients are just so fun to take care of. And currently we're not able to because we are a COVID unit. They're currently over on 8 Warner, but we really miss these patients because we get to know them on a very personal level. When they come in, they're here for about 2 to 3 weeks at a time. So we get to know their families, their kids, their parents, their dogs, their cats, just a really fun population to take care of. On to the next slide. So I'm going to briefly talk about what our journey is currently right now. So we became a COVID unit back in March of 2020. So we've been doing this for a little over 18 months. So we were asked to care for the patients on the med-surg side of COVID. So we take care of COVID positive patients and COVID rule out patients. What's really unique and different about COVID is obviously COVID doesn't care who you are, it affects anybody and everybody. So we take care of completely patients that have no comorbidities, and then we take care of patients that have lots of comorbidities. So, you know, patients just like in that previous slide with CHF, with diabetes, with hypertension. We've had an LVAD patient on our floor, patients that maybe came in with a heart attack, but they're COVID positive, they come to our unit. A patient that maybe had a motor vehicle accident, but they were positive, they come to our unit. So anybody that comes in COVID positive that doesn't need ICU level of care, they'll come to our unit. So we care for patients with very high amounts of oxygen demands. So this was something very new for our unit, to learn the different oxygen devices that maybe we had never had before. So one thing we do care for is patients on OptiFlow. And those patients can sometimes be on anywhere from like 40 to 60 liters of oxygen. So very high oxygen demands. So that was, like I talked about, very different for our team. And they had to go through some education to learn those devices and how to run the device. You know, we have a great relationship with our respiratory therapists, get to work really closely with them. So PPE practices on 5 West for the COVID patients. So we were N95 masks, face shields and goggles, gown and gloves. So at the beginning of COVID, we did have to extend the use of our N95 masks. So we did a process where we actually cleaned our N95 masks. We are no longer having to do that. Something I've always said, I'm so proud to work at Nebraska Medicine. We have never had a case where we didn't have enough PPE to do our job. And now we have enough or an adequate amount of supply of N95 masks that we actually don't have to extend the use of them anymore. So we're currently in our 3rd wave of COVID. We actually did have a little break from COVID this summer. We went about 3 months with no COVID patients, but unfortunately in August, our numbers started to creep up again. So we are, like I said, once again, a full COVID unit and have been for pretty close, like I said, 18 months. Go on to the next slide. So some experiences that you'll see on 5 West. So medications and devices. So cardiac drips, we see a lot of nitro, especially with COVID. We've had a lot of nitro, cardizem, and EMU. Sometimes these patients come in with heart issues, and we actually see probably more of these devices with COVID than with non-COVID. So that's been really interesting and unique for our staff to see those. So some high alert drips that we care for, insulin and heparin. So especially with our COVID patients, I'm sure most of you know, blood clots and PEs are COVID patients are very prone to these. So we have anywhere from 5 to 8 heparin drips on our unit on any given day. Also with patients with COVID, they all have to usually be on Decadron to help with the COVID symptoms. So we see a lot of insulin drips and a lot of just giving sub-Q insulin as well. So tubes and drains, we see central lines, we see PICC lines, ports, all of those things, indwelling urinary catheters as well. We see wound vacs, abscess drains, GP drains, and then I already talked about the high flow oxygen devices. So each shift consists of a nurse supervisor and or a team lead. So our nurse to patient ratios are 4 to 5 on days and 5 to 6 on nights. That's pretty typical. But I always tell people we have to adjust the staffing needs of the organization as well. So for example, if 6 and 7 lead is maybe got very much more high acuity patients and they need more help over there, we'll send a nurse over to them to help them, and vice versa. Maybe we have more high acuity patients on our floor. So our organization really works together to care for all patients on all units. And then talking about our CNAs, we have some amazing CNAs on our unit to help our nurses out. So highly trained, highly accountable, and their ratios are about 6 to 8 on days and 8 to 10 on nights. Our 5 West leadership team is just very, very hands-on, and we have a very open door policy. Me and Sarah, we like to come in scrubs every single day. We just want to get out there and help wherever we can. And then we also like to help with resume building, interviewing, and applying for school. All right, I'm going to let Sarah go now.
All right. So like Brandy said, we're a centralized nurses station. You can see that there in our pictures. Teamwork makes the dream work. We hear that a lot on our unit. We are known throughout the organization as the Wolf Pack. there's a story behind it. I don't know it anymore, but somebody somewhere came up with the wolf pack and it's stuck and it's never gone anywhere. We are very big on helping one another. And we really pride ourselves on that. We have very high quality standards on our unit. We've gone, I don't even know, Brandy, how long have we gone without a CAUTI?
2.5 years.
2.5 years. So we pride ourselves on our quality data. We are big on innovation. We are getting ready to pilot a care pair CNA pilot where we pair one nurse to one CNA and see if those two together can, what the patient ratio could go up to for that nurse, given that dedicated CNA. This is one of the innovative tasks that we're trying to do in order to help with this nursing shortage. We have a very strong relationship with our ancillary and provider teams. Their offices are right down the hallway. Our respiratory therapists are amazing. When we got the OptiFlow, they came and they'll train and teach as needed. When we get trach patients, they come out and they are very hands-on in helping our nurses learn and feel comfortable with the various things. We love having students. I currently have 2 different nursing student cohort groups on our floor, as well as 4 preceptor students on our unit. So all of our nurses, not just Brandy and I, enjoy teaching, and we just jump at the opportunity to enrich students' lives with what med-surg really is and how great it actually can be. Next slide, please. So I'm going to talk a little bit about orientation for new nurses, and this is pretty typical across the organization. So for new grad nurses, we are typically around that 6 to 8 week mark of orientation. For those coming in with experience, it can be around 5 to 6 weeks of orientation. We also have our new graduate nurses go through the nurse residency program, which you'll learn from Kaylee later. And that's the end of my time.
Did you guys
Oh, sorry. Yes.
want to
Last
say
slide.
anything about
Just
scheduling?
kidding. Yeah, so sorry, I froze. Yeah, so scheduling on 5 West, we hire straight days and straight nights for new grads. We also offer shift rotation scheduling as well upon request. Full-time employees are required to work 3 shifts of weekends every schedule period. And then Nebraska Medicine has their holiday teams.
Thank you so much, Brandy and Sarah. I really appreciate you sharing all that valuable information. Okay, so now we're going to be moving into our 3rd breakout sessions. We are so excited to get to learn more about our values and culture, diversity and inclusion, growth and development, and benefits. Are you recording, Nick?
Hello.
Hello. It says that we're already recording, so
Okay.
I think we are good to start going.
Okay, perfect. Well, welcome. It looks like some people are still hopping on. Once you join, if you can, turn your cameras on if you feel comfortable. It just helps me get a face to a name and, of course, makes it more interactive as well. My name is Kirsten Moses. I'm the talent development recruiter here for Nebraska Medicine. I mostly own our sponsorship program, so any of our educational programs that we partner with, any education institutions for financial assistance, and also recruiting for hard to fill positions. So I will be kind of owning this session to let you guys know what we have to offer at Nebraska Medicine for growth and development, but I'll also let Ashley and Nick introduce themselves really quickly.
You can go ahead, Ashley.
I think everybody knows me.
Oh
I'm
yeah,
Ashley.
yeah, good point. Good point. You're running the show. My name's Nick Wasley. I'm a talent acquisition sourcer at Nebraska Medicine, and thanks for all the attendees for joining today.
We're so excited to have you.
Yes, so I'm going to go ahead and share my screen if I have the ability to here. Can you guys see my presentation?
Yes. Yep, we can.
Got it? Okay, perfect. Sorry, that was a little bit delayed there. I was kind of like panicking. Perfect. So introductions, we got our names here. Nice to meet you all. Super excited to discuss our growth and development here at Nebraska Medicine. So we do have a development philosophy. I'll kind of run through a few of these things here in the beginning, because really I just want to know what you guys are interested in, have you guys have the opportunity to ask any questions just to make sure that we make the most of your time. But here at Nebraska Medicine, our philosophy is the process of identifying strengths and development needs and implementing strategies to leverage strengths and eliminate unwanted behaviors or fill in knowledge, skill, and ability gaps to that enhance the job performance or to help achieve a goal. So really, we're here to facilitate those things for you to help achieve whatever goals you might have in mind. And maybe to the next one. Here we go. So the concept of development here at Nebraska Medicine is we really want you to be the owner. We have all these tools and resources, of course, your leadership at hand at your fingertips to use, but really it's you owning that journey. What do you want it to be? So the first step would be, recognizing those areas in yourself and what you're wanting to move into and grow into, whether that's professionally, personally, just networking, getting to know the organization deeper, whatever you so have on your kind of bucket list or what you're wanting to fill your bucket more with, recognizing those areas. That first step that we want you to take after you kind of have that idea in mind is have that conversation with your immediate leader. So whether that is, a lead or a supervisor or your direct manager, have that growth conversation with your leader, because they are there to help support you make that first step in attaining that goal of whatever you have in mind. And then, of course, taking advantage of all the opportunities that we have to offer here at Nebraska Medicine. So whether that growth item is, you want to move into leadership, having that conversation with your leader, and then using the development opportunities that we have for you. And we'll discuss some of those here in a second. And just going back to what I was saying a little bit earlier is what is that you're wanting to fill your bucket in, or what is your sign? So here's a few indicators that we like to put into an acronym of sign. So what's your sign? What is that kind of spark in your head that you're wanting to work towards a goal? So something to think of when you're thinking of growth and development for yourself is, what do you feel success in? So that's the S in sign. So you feel successful and confident in this activity, you excel in it and have been rewarded or recognized for it. So I naturally just kind of always talk about leadership, but are you always like volunteering to help with new hires? Or are you that person that, people go to for advice? You kind of have that anchoring for leadership that might be your avenue. The I is instinct. So you find yourself drawn to this activity. But you can't help but want to do it. For me, that's always doing something that has to do with something to be organized. So organizing a project or, planning like a team outing. I am always drawn to those types of things. So that instinct, you can't help yourself but volunteer to do it. G is growth. So you find that you learn the fastest in this area. You're the most creative, insightful in this activity. You become so engrossed in the activity that you get lost in it. Like, it doesn't feel like work. It's fun for you. So whether that's, getting involved in a community group that we have here at Nebraska Medicine, that could be an area of growth. It's fun for you. It's not work. It's not something that you dread doing. And then the N is needs. You feel satisfied at the end of the activity and you can't wait to do it again. It's almost addictive. So again, it's not work. It's something that at the end you feel like your bucket is full, that you feel like you've been productive in that activity. So really, what is your sign? Or me and Ashley always like to say, like, what fills your bucket? Like, what makes you super excited to go and do it or feel fulfilled at the end of the day? Sorry, I'm moving my thing here. Next slide. always a little bit delayed. There we go. So talking specifically about nursing development opportunities at Nebraska Medicine. So wherever you would be at in your journey coming here, leadership is one that I always just naturally gravitate towards. And we have a new program that we've implemented at Nebraska Medicine. It's called the Aspire program. So this is a free program offered to our internals that is really for you to try out leadership to see if it would be something that you would enjoy. Some examples of positions that you can move into after being a nurse is that nurse lead position, a supervisor, manager, director. This is a self-paced development program, so you definitely can work with your manager once you're onboarded here, and participate at your own rate over those course of 8 months. So like I said, it is that opportunity to explore your potential in leadership. So if you're like, I don't know, I think I might like leadership, but you don't want to just take that plunge maybe before kind of trying it before you buy it type of deal. This is a great program for you to go into. There's no judgment if you start it and you're like, no, leadership's not for me. It's not what I thought. But just a great way for you to get involved, get that exposure into leadership before kind of formally taking that leap. The other thing is if you do join this program and you love it, it is kind of our pipeline of selecting leadership here at Nebraska Medicine. So you kind of get that hands-on experience, so you are more equipped to be successful when you're going into that leadership position. So that's the Aspire program. Some other experiences for development opportunities as a nurse here at Nebraska Medicine that we have thought that would be beneficial rather than just going up in the ladder into leadership would be volunteering for a department project, for example, a preceptorship. So I know Ashley might talk a little bit more about this, but this was something that she loved when she was in nursing. We also have a Gateway Nurse Mentor program. The Gateway program is for those areas of the community that are a little bit harder to get into the nursing world. So you are partnered with these new grads to be their mentor. So if that's something that, it's kind of a leadership opportunity, but not formal leadership, you get to kind of walk that new nurse hand in hand and make sure their experience at Nebraska Medicine is a great one from day one. So those are a couple of project opportunities that we thought would be great for an experience. Also, job shadowing other specialties. So whether you start in one area and it might not be, you're not feeling your bucket's not full, make sure you're talking with your manager, and we definitely encourage you to job shadow other areas that, is there certain patients that have certain levels of care that you really love? Is there a specialty that you can go into that route? And networking within the organization, exploring non-clinical careers. So Ashley is kind of our bread and butter, talking about that line of career path. She was a nurse for 15 years and now she's on the talent acquisition team. She's using her nursing experience in a different way. So that's definitely not something that's looked down upon. If you're wanting to get out of clinical areas, there's many positions at Nebraska Medicine that actually require a nursing background, but might not be your typical clinical, bedside nursing career path. And lastly, I kind of alluded to this earlier, but we do have some amazing employee resource groups. Just a few to name is the LGBTQ Alliance, the African American Black Alliance, we call that ABBA, and then the emerging professionals. So these could be some groups that you could join in, might not be specifically correlated to your everyday work, but an area that you could grow personally. If these are groups that would be of interest to you, they do special projects. They go out into the community for lots of volunteer opportunities. Really awesome. I think that Nebraska Medicine offers these. We also have 1 day of PTO that you can take that doesn't count against your PTO, I guess, that you can use for an 8-hour volunteer day that if you're a part of one of these groups that you'd be able to use those hours for. So some fun, different ways to think about growth. It's not always just, moving up the ladder into leadership. There could be some other areas of opportunities for you if that's the route that you're wanting to fill that bucket. Anything you wanted to expand on, Ashley, on those specialties or anything that I missed?
No, I think you touched on a lot of really good points.
I know, I feel like I'm talking really fast, so.
Can I
please-
butt in a little bit,
Yes,
guys?
butt in, Kaylee.
I think there are quite a few clinical development opportunities that are out there for any nurse, regardless of knowledge level or years of experience. And so those include a lot of developmental programs for clinical settings. For example, we have about 10 different fellowship programs, depending on where you work. Sarah on 5 West has a med-surg fellowship. In the Warner, which is an oncology building, they have an oncology fellowship. There's critical care. We even have one for the educator group. And so those are meant to help you develop clinically, because we are a very acute hospital and we take very specialized patients. And so orientation may be 6 to 12 weeks, but you'll also be enrolled in a fellowship program to help you develop that critical thinking and clinical expertise. For example, for the cardiology fellowship, one of their days is LVAD, ECMO, balloon pump, heart transplant. And so you'll take a class every month or two, and you'll take the class and develop competence before you would ever take those patients. We also have classes on everything you could possibly think of clinically. So are you interested in trauma-informed care? Go to this. We offer about 500 to 600 classes a year, and they're free for anyone to go to. And so that helps a lot of grad students who are in classes for like APRN and need to know critical thinking and critical care. So they can join in on some of those fellowship classes and get that advanced knowledge. And then we also have developmental programs like preceptorship. We host about 400 nursing students a semester, and we also have a lot of new and experienced nurses join our team. And so we do have a preceptor program. And then we have a strong commitment to development of others. And Brandy and Sarah spoke to this a little bit. We're committed to get you where you're going. If you tell me that you want to be a nurse anesthetist in 3 years, I can tell you how to get there and give you a path to make sure that you get the exposure, and we know the criteria for the schools, and we can help get you there.
Awesome. Thank you, Kaylee, for butting in there. You definitely have that specialized expertise in the nursing world, so I appreciate that. The next opportunities that I'm going to talk about are what we all love to hear, is about that money, financial assistance of what Nebraska Medicine has to offer. One of our newest program is the RN to BSN sponsorship program. So if you're currently an RN and you're looking to get your BSN, we do have a partnership with Clarkson College where we would fund your entire BSN program. So the partnership with them is you would work with us as an RN while you're obtaining your BSN for 2 years. Then at the end of the program, once you graduate, then you would work for Nebraska Medicine for 2 years as a BSN. Again, that tuition is fully funded by Nebraska Medicine in partnership with Clarkson College. We are opening our enrollment ongoing right now, as we just kind of kicked off this program. It's brand new. That tuition or financial assistance does include books and fees, so it doesn't just go to the tuition. And then you are held to a 2.5 GPA standard. And then if you are a new grad nurse coming into the program, like Kaylee said, we have that nurse residency program for new grads. And I think, yeah, Kaylee, you'll be talking a little bit about that after this breakout too. So this is super exciting. It's a huge financial opportunity for those that are looking to get their BSN. And we're definitely wanting to help you get there if that's the route that you're at. And how do you apply? Who do you reach out to? Either myself or Ashley. You can reach out to either of us if you are interested. The application process does start with Clarkson, but you can reach out to us specifically. We also do have it posted on our career site. The next opportunity I'd love to talk to you guys about is specifically to the nursing student loan repayment assistance. So this would be for any loans that you have already taken out that Nebraska Medicine would help pay $100 a month towards those student loans. This is only offered to the full-time staff nurses, leads, and supervisors. It is through our Prudential Retirement Program. The loan does have to be in your name, but there is no capped maximum amount, and there's no retention contract to this program. So this is something really great to take advantage of. As we know, everyone comes out of school with student loans, and it's something that we feel strongly to help support you in getting those paid off, being a nurse here at Nebraska Medicine. And lastly is the tuition assistance. So this would be for any education that you're looking to pursue after being employed here at Nebraska Medicine. We offer up to $5,000 per academic year for a full-time employee. You do have to have that 1-year commitment, and then part-time is $2,500 per year for a part-time employee, $2,500. So this can be put towards any program that you are going into. So undergrad, graduate classes, at any higher education accredited institution. And the eligibility for this program is you do have to be employed with us for 6 months, be in good standing. And then obviously this education does have to benefit Nebraska Medicine in your capacity on your team or for the organization. So there is an application process, but $5,000 per year for a full-timer is a lot of money when you're talking about it consecutive years. If you're, already a BSN, you want to go for your master's, we've had plenty of people go through that way to support your education journey. And I know we're like coming up on time, and I just want to make sure that we have time for questions. And then if you are interested in any of these programs or employment, anything, you can easily scan this code and fill out a form. There's an interest box. You can put in, I'm interested in the sponsorship program, or I'm interested in employment. You can fill that out easily to submit your information. But any questions, I would like to open it up, and here's our information here. I'll just leave up for you guys to snag. Any questions? I think Shelby, Nicole, Madhu. No questions?
Thank you.
Any information that you guys were looking to hear that you guys didn't hear today? Just want to make sure that we cover everything that you were interested in.
I'm actually a nurse that is trying to get back into working. I haven't worked for in a setting, a clinical or hospital setting for a while. So I do have my BSN. My license is current and everything. I just trying to figure out how to get back in after being a stay-at-home mom for quite a while. So I don't know who I need to talk to regarding that.
Reach out to either Ashley, Harrill, or myself. We'll be happy to help you.
Thank you.
Yes,
It's
absolutely.
like riding a bike. It comes right out.
It does. I stayed home for a few years, and then I came back in, and it really was like you started and you were like, oh yeah, okay, I remember this. I'm okay. I can do this.
Yeah,
So.
definitely. We'll be happy to help you find the right spot, Nicole, definitely.
Okay, welcome back, everybody. So I wanted to say at this point, thank you so much for everybody who attended this morning. Please feel free to go to our career site, nebraskamed.com/careers. If you are interested in looking at available positions that we have at Nebraska Medicine. Please feel free to email me any questions that you may have. We will be sending out a recording of this event as well as a survey this week to get your feedback, and then you'll have my contact information as well if you have any questions that I can assist you with. We would ask any new graduates or soon to be graduates to hang on with us for the last 20 minutes here. And Kaylee Guinan will be sharing about the nurse residency program for new graduates at Nebraska Medicine. But if you are an experienced nurse or you've gotten all the information that you needed, you are welcome to drop off or hang on with us and listen to Kaylee share about our nurse residency program.
Ashley, I just have a quick question. On the previous
Absolutely.
slide, your email was listed as A Harrill at Nebraska Med, and now it's listed as AS Harrill.
Oh,
Which-
yep, it is AS Harrill. Yep.
It is?
Yep, it is. Did I
Okay.
have it wrong? I'm sorry.
Okay,
Yes,
thank
it
you
is
very much.
AS Harrill at nebraskamed.com. Thank you for pointing that out. Great. Did we have any other questions before Kaylee started her presentation? Okay, perfect. Kaylee, if you would like to present on the nurse residency program, we would love to learn more.
Hi guys, like Ashley said, my name's Kaylee. I'm a nurse at Nebraska Medicine and I started here as a new grad, probably before you were born, and I never left. I had a path like they talked about. I started on, it was geriatric rehab unit. I thought I wanted to be a geriatric nurse practitioner someday. And I worked there for about 6 months and decided that was absolutely not what I wanted to do. And so I went to 5 West and I just loved it. It was absolutely amazing. I worked there as a staff nurse and a lead for about 7 years. And at the time, the floor split into 2 units. And I stuck with the unit, but moved to the new one, which was CPCU, but is now HVU. And so I did cardiology, clinical nursing for about 15 years. During that whole time, I was precepting new people, or as the lead, I was helping new nurses on the floor to kind of guide their practice and develop their critical thinking. And I knew that was really what I wanted to do. And during those years, I had 3 kids. I worked every FTE, every shift, and I just made it work with my life. And that's what I appreciate most about Nebraska Medicine. I've been able to find my passion, make it work with my life. And after the 15 clinical years, I went to employee development where I did new colleague orientation, care provider and nursing orientation. And then that job kind of rolled into a couple others. And right now I'm the manager of nursing professional development. There are about 3 of me who look at housewide needs, and then we have 40 nursing professional development specialists. You met Sarah, across all of Nebraska Medicine. So clinics, procedural areas, and hospital-based areas. And our whole job is to help people onboard to Nebraska Medicine, orient, develop, have the educational needs and do all of that. And I really, really found that this is my passion. So I've stuck with that. The favorite part of everything I do is this nurse residency program. So you guys, I'm sure, heard about this all through your nursing career, but we know without a doubt, evidence shows that it takes a year to transition into a new job of this clinical type, a whole year. And so we have had this program in place since about 2009. And the intent of the program is to support new grads through the first year of their practice. You will figure it out really quickly after you get out of school and start on the floor, but it's overwhelming how nursing school prepared you to be a nurse, but it's very different when the patient load is on you and all the decisions are on you. And this program helps you to think critically, become a bedside leader, and deal with the first year transition. So Ashley, if you can go to the next slide. Part of that first year transition is getting to know the people that you work with and establishing relationships with your peers. And so for nurse residency, what we do is we wait about a month or 2 after you start at the hospital, and we have a cohort of nurse residents. We do this 3 times a year to coincide with graduation dates. So all the July and August grads start on, I think it's November 7th. They'll start in the program together as a group. Same with May grads and December grads. And so we'll have a cohort of new nurses from all over the hospital, and we meet once a month for 11 months. And during that time, the first hour or two, we have a topic of the day, and the second hour or two, you meet with a small cohort group. So the morning session may be 70 people, but the cohort group will be about 10 nurses based on like area, and it follows a topic of the day. So for example, the topic of the day is resource management and communication. And that's what the first hour or two will be. And then the second hour or two, they'll talk about how that looks like on the floor and share stories with each other. And those small cohort groups kind of become your people. And honestly, some of my best friends are those that I started with as a young nurse, even 23 years later. And so that's how we do each section. If you go to the next slide, or actually go to the schedule, Ashley. Yep. So this is what the schedule looks like. The program that we use is the Vizient AACN Nurse Residency Program, and that is the gold standard for the country. There's about, well, this year alone, there's 22,000 residents in that program. Nebraska Medicine has 250 of them. But we know that this program is evidence-based. That's how we know it takes a year to transition. We also have a lot of data from both the Vizient and Nebraska Medicine past residents. So we know what new nurses need and when they need it. And that's how we build the program. So we start with intro to the program and getting to know what the next year will look like. And we talk about self-care. Then we'll talk about resource management, medication safety, evidence-based practice. And as you go through the year, the topics get a little bit deeper to meet you where you're at. Go back up to this one. So the schedule is based on that, as is this transition. If you start on the left-hand side where it has well-being down to distress, that's when you start a program. That access is the bottom is if you're just a mess, and the top is if you're perfectly happy, healthy, well-adjusted. And you all know we're a spectrum of that every day of our lives. And then the bottom access to the left of the slide is the first starting as a new nurse. And as you go to the right, it goes through the 12 months of your first year. This is why we feel strongly that residents need a program and why Nebraska Medicine has committed these resources to develop you guys. We know that when you start as a nurse, you have, we call it the honeymoon phase. You're happy. You are so excited. You've told everyone you know you're a nurse, you pass boards, you start, you're excited to put in a catheter. Like everything is new and exciting. This is what you've studied 4 years for. This is what you're doing with life. You're way up in the clouds with excitement. That phase lasts for only about 5 to 6 months, and then you transfer to the shock phase. The shock phase is when you think, oh my gosh, what did I do? I can't believe I'm doing this. You sort of just have a lot of confusion and anxiety and, oh my gosh, just shock, okay? That's the low point of your year. After the shock phase, you hit the recovery phase, and that's the upward climb of you starting to be able to balance like, oh, it's not that bad, or this is good and this is bad, and you can process everything you've learned and where you're at, and you kind of climb up. And then the last phase is when you completely resolve that and you're kind of done with the transition. We know this is absolutely the route that people go through on the first year of a new job. So if we know that, we can do things to make you not hit as low and recover faster. And that's what the blue line in this slide is showing. And so we put a lot of supports and education and resources in place to help you, because we don't want you to hit that low point of the shock phase, and we want you to recover faster. That's what the nurse residency program is all about. In addition to the nurse residency program, we have a lot of leaders and preceptors out there supporting new people, new grad or not. We're checking in on you all the time. We're making sure that you're doing okay. We're setting you up for success, and we're really looking out for you. And then after you come off that blue line, you're through the transition. And we know that nurses who go through the program are more confident and competent professional nurses. You can put the slides down, Ashley. I'm just going to talk for a bit. The nurse residency program really, I think, helps, like I said, to support people, and it really focuses on a few key threads that we have in every month of the program: bedside leadership, professional development, developing you as a clinical nurse. All of those are built into the program. I want to clear up one thing that I think confuses a lot of people. Nurse residency is an orientation. And so when people start, they have an orientation, depending on where they're going, of about 6 to 10 weeks. That's orientation. We also have nurse residency. We also have clinical fellowships. We also have additional classes depending on what you're doing. For example, if you're on an oncology floor that gives chemo, you take a chemo class. So all of these different categories are kind of part of you learning and developing through your first year, and all of them together really make for successful nurses. And those successful nurses then have the foundation to do anything in the future, because they have the skills and they're prepared for it. So that's kind of the overview of the nurse residency program. Are there any specific questions?
I have a quick question. Does every new nurse, like new grad, or do they all go through this program?
Every new grad nurse who's in a hospital-based setting. And so no matter what floor you were on, you go through it. You don't have to apply. It's not a competitive process. Everyone who starts is included in it. We have something a little different for the ambulatory areas, because that's a whole new world. But everyone will go through it. And we do about 250 new nurses a year.
Are Bellevue and main campus nurses combined, or does Bellevue campus do it separately?
They do. It depends on how many people are there, but Bellevue's absolutely included. Sometimes we make Bellevue its own cohort group. And so they'll Zoom to the morning first hour or two if they're doing an activity at Bellevue afterwards. But yeah, everyone's included.
And at this time, is it being done via Zoom, or are you guys meeting?
It depends on the group. Right now, we have a room restriction of 25 people per room, unless it's like a theater. But we don't have that right now because they're doing flu shots in that room. And so when we do the sessions, usually the cohort groups will meet in person in smaller rooms, and zoom into the topics of the day. And so those 10 or so people will be in a room together, but we'll have 7 rooms of 10 people. When the restrictions aren't there, we meet in person. It's just part of it is socializing, and we like people to get to know each other because you see them all over the place.
Great. And we had another question in the chat. So you meet once a month for 11 months.
Yep.
Okay.
Yep. It's 3 to 4 hours a month. It's considered part of your work schedule, so it's paid time. We have the calendar about a year in advance. And so when you start in nursing orientation day 1, we hand you a schedule and we tell you what cohort you're in. And then it's just built into your activities.
Great. Thank you. Were there other questions for Kaylee?
I'll put my email in the chat. My real name's Michaela, so I swear it's me, but you're welcome to reach out. We have, I think someone mentioned there's an onboarding packet, and there's also a nurse residency flyer that gives some of those details, and you're welcome to reach out to me at any time.
Thank you so much, Kaylee, for sharing all of that information. So that brings us kind of to the end of our open house today. Again, I would encourage you to visit our nebraskamed.com/career site to look at different openings that may be of interest to you. Just to reiterate, if you are a new graduate or soon to be new graduate nurse, you are welcome and encouraged to apply within that 6 months. So you can start applying 6 months before your graduation, go through that interview and application process and kind of get that taken care of so you don't have to worry about that throughout your last semester. And then that position would be held for you until you are ready to start working. And thank you so much for everybody who attended. And if you have any questions, please feel free to reach out. I would be happy to answer anything that you may have lingering in the back of your head. Okay, well, thank you all so much. Have a great rest of your Saturday.